We love this time of week because we get to find out, well, first of all, a lot of your fantasy lineups are getting set, so you want to find out what's going on with the injuries. But here in Tampa Bay, we want to find out what's going on with the injured Bucs players. And for a lot of people, we hear they are dealing with a lot of these nagging injuries as well. So we love talking with our doctors from the Florida Orthopaedic Institute in partnership with Tampa General Hospital. The Pat and Aaron Show Injury Report presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And joining us now on the hotline, Dr. Craig Radnay. Dr. Radnay, how you doing? Thanks for joining us this morning.
Hey, good morning. Thanks for having me.
So you specialize in sports and reconstructive foot and ankle surgery, also arthritic disorders of the knee. And speaking of the knee, we got to start here with our left tackle, Tristan Wirfs of the Tampa Bay Buccaneers. He's got the sprained MCL. Is this the best case scenario considering how severe some of these MCL injuries can be?
Yeah, I mean, the MCL is actually the most common knee ligament injury in professional football. And fortunately, even though it's a really important ligament, most of these will always heal on their own. It just depends on timing of return and return to play, depends on the severity and their position. But when you have what's called a low grade or a grade 1 sprain, that's pretty much the best case scenario, because in this situation, the ligament's really just stretched as opposed to completely torn. So hopefully, with appropriate rest, and probably need a brace for the rest of the season, but hopefully within 2 to 4 weeks, we could see him back in the field, hopefully as soon as the Giants game.
Yeah, and how much easier is it, Tristan? He's become a veteran when it comes to football standards, but still a young man. How much easier is it for a guy like Tristan Wirfs, who's as young as he is, to recover from something like this, especially like you said, you can kind of play through it for the rest of the season, as opposed to a guy that's maybe been in the league for 10-plus years?
Well, certainly, I mean, we all wish we were younger. I think the younger we are, the healthier we are, the easier it is to heal. And he knows his body. He's going to protect himself, and I'm sure the team is not going to want to bring him back before he's ready. I think a lot of it depends also on the position that you play. So, Vita Vea had this injury at the beginning of the season in the Lions game, and that was originally diagnosed as a grade 2, so maybe a little bit more severe. But defensive linemen sub in a lot more than the offensive linemen. He was back within 2 weeks. Even Jordan Love had a similar injury. He was originally projected to miss 3 to 6 weeks. He only missed 2. So hopefully Tristan, with appropriate rest, and he gets this bye week to help him and a brace and stuff, he'll recover and be back before long.
Let's say you're working with a young athlete, like a high school athlete who plays on the offensive or defensive line. Do you give those guys different advice based on the fact that one guy's going to be out there every snap and another guy might be able to get some plays off?
I think you have to. I mean, certainly when it's a professional and it's their livelihood, you also treat them differently than someone who's younger, like a high school player. But it depends a lot on the position, because the ligaments are really the primary stabilizers for the joint, especially the knee. And you have to look at all the start-stop, cutting, side-to-side activities that you're doing that's going to stress that ligament. So certainly as an offensive lineman, you have a lot of that, and you're trying to plant your foot and resist all this stress from all these heavy defensive linemen coming at you. So you definitely treat different players, different positions differently.
Miles Sanders of the Carolina Panthers, he likely fractured his lower ankle in the fibula. What's the fibula, and how do we see some of these injuries occur to the fibula?
The fibula is basically the calf bone, so at the ankle, it's the smaller bone on the outside. Fortunately, right now, it actually looks like he's done extensive tests. It looks like it's now being reported as just a left ankle sprain, so it does not look like he actually broke anything. So fortunately for him, it doesn't look like there's going to be anything surgical. He should not necessarily be out for the rest of the season. So at this point, typically this is more of a day-to-day or a few days to a few weeks kind of thing. It sounds like he has a lot of swelling that has to resolve before he can come back, but hopefully he'll be back as well, and the bye week will help him as well.
And the Carolina Panthers in general have been done for the year for a while. So at that point, when it comes to winning, it doesn't matter.
Yeah, let's
right. We need that on our schedule.
That's right.
Yeah, we got it twice. Let's say that it were, right? How difficult is it if you do have to recover from something like a broken fibula?
Again, there are different levels of severity. So there's some breaks or fractures of the fibula that we can treat without surgery. So we can treat them, they can walk and a brace. And some of them obviously much more severe that require surgery and more extensive recovery. But anytime you break a bone in the body in an adult, it really takes around 3 months to heal. But a lot of these are pretty stable, usually after 6 weeks.
Dr. Radnay joining us right now from the Florida Orthopaedic Institute. We were talking about the MCL with Tristan Wirfs. Dalton Kincaid of the Bills is dealing with a PCL sprain. What's the difference between the MCL and the PCL?
The PCL is another ligament in the knee. It's a posterior cruciate ligament. So you have the anterior cruciate ligament, but the posterior cruciate ligament is behind it, so it's in the back of the knee. That's a ligament that prevents the leg bone or the tibia from moving backward.
When it comes to foot injuries, again, you're specialty. When you talk to people, because there's a lot of us here in Tampa Bay, well, I shouldn't say us, I guess, when it comes to running, a lot of people that love to run to stay fit. What do you say to people that are dealing with foot issues? And a lot of times it's people, they wake up in the morning, they feel them right away, but they really want to continue to run.
I think it's important we should all try and stay as active as possible. And, at some point, if you're having persistent pain that limits you, it's always, I think, beneficial to see a specialist. It could be something as simple as having appropriate shoe wear or having appropriate inserts in your shoes to provide some support for your arches. But in general, it's good to be active. But if you're having problems and pain specifically with running, which is a lot of impact, then you should try and at least cross-train a little bit with non-impact stuff like bicycle, swimming, elliptical, yoga, Pilates, that kind of stuff.
You mentioned inserts. I think a lot of people hear about them. I know there's a big company around here that does them, and maybe they think, wow, could that really help me a lot? How beneficial can inserts be for people with foot issues?
I think they're very helpful. I mean, it's not that every foot issue can be cured with inserts, but we're all made differently. Some of us have a little bit flatter feet. Some of us have the opposite, where we're kind of rolling on the sides of the ankles, and sometimes it can just take some inserts to reposition you, realign you, rebalance you. That can help with everything. Obviously, sometimes there could be some other underlying issues that require a little bit more attention, but inserts can be very helpful.
Doctor, did you see the Chad Kelly injury? He used to play in the NFL. Now he's playing in the CFL in the playoffs. He had a gruesome leg injury. I don't know if you saw the video.
Yeah, I saw it. It's always painful to watch that stuff. He got tackled awkwardly by the lineman, but it sounds like his surgery went well. In the end, he ended up breaking the one bone, the tibia. So hopefully he'll be able to return, but an injury like that, recovery is usually at least 6 to 9 months, no football activities.
Wow.
What do you need to see? And I guess I shouldn't say need to see because it's something you don't want to see, but what is it that you see within a leg injury like Kelly's that, you said 6 to 9 months he should be able to come back. What are some of the things you see in an injury where you say, you know what, this might have to be the end for you?
It's tough because, again, he's a 30-year-old. He's a professional athlete. They've dedicated their whole lives to this. Their careers in general, as we know, are pretty short. But a lot of times these injuries can be much more severe than that. You could have injuries also to the blood vessels, affecting the circulation to the leg. You could have infection. We saw what happened with Alex Smith a bunch of years ago. So there are other issues like that are more obvious in terms of decision makers. But in general, you want to give them the best chance they can. If they can return and be functional and be pain-free and obviously be able to play at a level that allows them to continue playing, then we want to support them as best we can. But typically, once you fix the fracture, once it heals, it should be fixed.
Doctor, I typically will ask a selfish question about myself and something going on, and this is going to be no different. I have one for you today. I used to stretch all the time when I was playing high school sports, and I realized I don't stretch that much when it comes to my legs. I used to be able to extend my leg fully when I was stretching it. Now I can't really do it and get my hand out there. Will I ever be able to, if I keep stretching, will I ever be able to get back to where I was, or am I done for?
Well, I think we all experience this, but I wouldn't say you're done for, but it doesn't happen overnight. So slow and steady kind of wins the race. So little things like even before you get out of bed in the morning, just kind of stretch your legs and pull your feet back and stretch it out, even just for 10 seconds before you stand up. You feel a lot more limber. And then, if you work in stretching just on a regular basis and start stuff like yoga, Pilates, you can notice a big difference in just a few months.
I love it. I'm going to start doing that every single morning. I got the bands. There's still hope. Thank you, Dr. There's still hope for me. Dr. Radnay, Dr. Craig Radnay. Make sure if you're dealing with any injury, these are the people to reach out to. The Pat and Aaron Show Injury Report was presented by Tampa General Hospital in partnership with our good friends at Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. Schedule an appointment today at floridaortho.com. Dr. Radnay, really enjoyed our conversation and look forward to doing it again.
Thanks a lot. Have a great day, guys.
Thanks, Doc.